One of the major concerns for nurses, and recognized as a major competency for the CUSIN initiative, is safety. Nurses are always trying to design new ways to keep patients safe and keep the work environment hazard-free. Safety is a basic human need. It's second only to survival needs such as oxygen, nutrition, and fluid. As a nurse, you will be fundamentally concerned with the safety of your clients. You must also be concerned with your own safety and the safety of the other care providers. Many accidental injuries can be prevented by being aware of hazards and taking reasonable precautions. What are some patient safety concerns that you may have come across? Many times, patients who become combative or are at risk for falling are put into soma beds. This is a type of netted enclosure that keeps the patient safely in bed. They cannot get out unless someone is with them from the outside, and they are free to move about inside. Nurse safety concerns that I can think of off the top of my head are the Sarah lifts or Hoyer lifts that keep nurses from hurting their backs with obese patients or immobile patients, and safety training in case of a major catastrophe. Safety concerns change with the age of the patient. We must be aware of the age of the person when deciding what interventions will keep the patient safe. Motor vehicle accidents are the leading cause of death for children ages 1 to 3, then followed by drowning. Falls, choking, sudden infant death syndrome, and ingesting poisons are other critical safety concerns. Infants and toddlers are completely dependent on others for their care. They have the ability to walk and manipulate objects before they have the judgment to recognize dangers such as falling. In addition, infants and toddlers are curious and tend to explore the environment by putting objects in their mouth. This is why the incidence of choking is highest between 6 months and 3 years of age. As mobility continues to improve, toddlers gain more freedom, and their curiosity leads them to explore cupboards, stairs, open windows, swimming pools, and other hazards. It's a good idea to educate parents on having the Poison Control Center's number available when toddlers are in the home. In the hospital setting, nurses should be aware of chemicals, medications, and other things on the unit that may be harmful to the child and ensure that those items are out of reach. Motor vehicle injuries continue to be a major cause of accidental death, along with drowning, fires, and poisoning. However, falls are the primary cause of non-fatal injury in preschool-aged children. After age 3, children are a little less prone to falls because their gross and fine motor skills, coordination, and balance have improved. However, the extension of play to the outside environment, like playgrounds, pools, front yards, and so on, creates additional safety concerns. Motor vehicles continue to be the leading cause of accidental death in children in this age group. However, the leading cause of non-fatal injuries is falls. School-aged children have developed more refined muscle coordination and control, and their decision-making skills have improved. However, because they become more involved in activities outside of the home, bone and muscle injuries are common. Injuries are often related to sports, skateboarding, or bicycle riding. Playground injuries are also common. Most school-aged children are ready to try any new skill with or without practice or training. They are less fearful than toddlers. Exposure to the wider school and neighborhood environment also increases the risk for injury inflicted by people outside of the home. An example of this would be like abduction. The leading cause of death in the age group of adolescents is motor vehicle accidents, then it's followed by homicide. Both of these are frequently associated with alcohol or drug use. And today, motor vehicle accidents in adolescents is very much related to texting and driving. Sports and recreational injuries, including diving and drowning incidents, are also common, especially when drinking and drug use are involved. Peak physical, sensory, and psychomotor abilities give teenagers a feeling of strength and confidence, yet they lack the wisdom and judgment of adults. This combination, along with feelings of being indestructible, makes them more likely to participate in risk-taking behavior and, in turn, more prone to injury. Poisoning, such as drugs and alcohol, is now the major cause of death and injury in adults, followed by motor vehicle accidents. Workplace injury may also be a significant concern. Other injuries to adults are related to lifestyle, such as excessive alcohol use or smoking, stress, carelessness, abuse, and decline in strength and stamina. For many, work and family responsibilities often leave little time for regular physical activity, increasing the risk of musculoskeletal injury in the weekend athlete. Although many older adults have intact senses that enable them to continue to enjoy life as they age, physiological changes do occur. These changes may include reduced muscle strength and joint mobility, slowing of reflexes, decreased ability to respond to multiple stimuli, and sensory losses, particularly hearing and vision. These changes increase the older adult's risk for falls, burns, car accidents, and other injuries. Falls are the most common cause of accidental death for adults ages 50 and older. In meeting the safety needs of the adolescent client, it would be necessary for the nurse to focus his or her teaching on, and the answer is D, driver's education. The leading cause of death for adolescents is motor vehicle accidents. In addition to developmental stage, individual factors also influence a person's risk for unintentional injury. Modifiable lifestyle risk factors include smoking, drinking, and other risky behaviors. Cognitive awareness lessens when a person is highly stressed or begins to age. Their memory becomes more impaired. Short-term memory loss is often seen in these patients. Sensory perceptual status are the senses such as vision, hearing, and pain. When these abilities are gone, your first line of defense is diminished. Ability to communicate may be impaired related to different disease processes. Take a person who has had a stroke. Oftentimes, they lose their ability to form sentences or words appropriately. This can also cause concern when swallowing. Mobility status is a concern we previously discussed. When we have impaired mobility issues, we are at risk for falls, strains, and decreased endurance. Physical and emotional health tend to become affected as we age. Along with physical impairment often comes depression. When someone does not have the abilities to do things that they once took for granted, they often become depressed. You then must watch for signs of suicide or other self-harm factors. Awareness of safety measures. This may include a lot of different aspects, but one of them comes to mind is that the person who is confused or delirious. They may cause harm to themselves or others unintentionally. Most poisoning of young children occurs because of improper storage of household chemicals, medicines, and vitamins. Another one includes cosmetics. It is important to educate parents to keep cabinets and storage areas locked when not in use. Older children and adolescents may attempt suicide by overdosing with medicines or may be poisoned accidentally by experimenting with recreational or prescription drugs intended for adults. Parents of adolescents should be mindful of prescription pills. Youth are often curious or can be suicidal, so meds should be locked in a safe place or out of the home altogether if this behavior is expected in a child. In adults, most poisoning occurs as a result of illegal drug use or misuse, or the abuse of prescription drugs, especially narcotic medications, tranquilizers, and antidepressants. Other poisonings include alcohol. Treatment choice depends on the poison ingested. For most poisonings, the most effective intervention is professional administration of activated charcoal orally or via gastric tube. However, charcoal is not effective for ethanol, alkali, iron, boric acid, lithium, methanol, or cyanide. Depending on the situation, other options for medical treatment include gastric lavage, dialysis, administration of antidotes, and forced diuresis. Syrup of ipecac used to be the treatment to have on hand in the home in case of accidental poisoning. But today, research shows that it actually can be very harmful. Never induce vomiting when the ingested material is acidic or could be caustic to the esophagus. Carbon monoxide is a colorless, tasteless, odorless toxic gas. It is harmful to a person when it binds to the hemoglobin in the blood. Exposure can cause headaches, weakness, nausea, and vomiting. Prolonged exposure leads to seizures, dysrhythmias, unconsciousness, brain damage, and death. The burning of fuels such as wood, oil, gasoline, natural gas, kerosene, and coal produces carbon monoxide. Dangerous levels of carbon monoxide can build up because of a faulty furnace, and it builds up very quickly in an unventilated garage when a car is running. Other consumer products involved in carbon monoxide-related deaths include lawnmowers, charcoal grills, gas water heaters, camp stoves or lanterns, and gas ranges or ovens. Many carbon monoxide deaths occur during colder weather among older adults and the poor who seek unconventional heat sources such as gas ranges or ovens to stay warm. Scalds and burns from the stove are the most common cause of burns in children younger than age 3. Warming food or formula in the microwave may cause food to become hotter than intended. This can lead to burns in infants and younger children's mouths. Sunburn can cause a first or second degree burn, and burns may occur from contact with metal surfaces and vinyl seats when cars are parked in the sun. You should teach parents to make sure that they check the car seat before putting a child in the seat. Scalding burns, especially on the feet and the hands, and cigarette burns in children and vulnerable older adults should always prompt you to assess for abuse. Home fires are a major cause of death and injury. Older adults and children younger than age of 5 have the greatest risk of fire death. Cooking fires are the #1 cause of home fires and home fire injuries. However, most fatal home fires occur while people are asleep, and most fire-related deaths occur from smoke inhalation. Many times, these deaths happen because the family either did not have a smoke detector or the batteries were dead. One safety concern is for people who smoke in the home. Fires can occur when the person falls asleep with cigarettes in their hand and either catch their clothes on fire or the home itself. This acronym, RACE, is used to help a person work through the steps of extinguishing a fire and rescuing persons involved. Environmental factors that contribute to falls include slippery floors and bathtubs, lack of grab bars, low toilet seats, high beds. Preventative fall measures may include non-skid shoes or safety socks in the inpatient setting, proper lighting for mobility purposes, rails in the bathroom or stairways, and keeping the floor tidy. Often, older people trip over a rug or other items sitting in their way. Health issues that increase the risk for falls include poor vision, hypotension, previous falls, dizziness or pain, alcohol use, cognitive impairment, polypharmacy, which means multiple medications which can cause different side effects, arthritis, gait or balance deficits, and anyone older than the age of 80. Gun ownership is a very controversial issue. Some people keep guns in the home for protection or recreation. However, guns are a source of unintentional injury and death. Gun safety and security are especially important when there are children in the home or someone with a substance abuse problem. Young children may handle a loaded gun with tragic results. Household access to firearms has been implicated as a risk factor for youth suicide and domestic homicide, as well as unintentional injury. Because of the frequency and severity of unintentional firearm injuries involving children, the Academy of Pediatrics and other groups have mounted efforts to educate parents about firearm safety. Suffocation by smothering is the leading cause of death in infants younger than 1 year of age. Suffocation may be caused by drowning, choking on a foreign object, or inhaling gas or smoke. Food items include hot dogs, raw vegetables, popcorn, hard candies, nuts, and grapes. These are very responsible for non-fatal choking incidents. Non-food items such as latex balloons and plastic bags cause the majority of suffocation deaths in young children. Suffocation of infants is often related to bed or crib hazards, such as excess bedding or pillows, or toys hung from long ribbons inside of the infant's crib. Infants can become entangled in cords from window blinds or in the ribbon or string used to hang a pacifier around an infant's neck. Take-home toxins are hazardous substances transported from the workplace to the home. The National Institute for Occupational Safety and Health reports that pathogenic microorganisms, asbestos, lead, mercury, arsenic, pesticides, caustic farm products, and dozens of other agents cause significant morbidity and mortality in the homes of workers. These toxins are most likely transported to workers' homes, on the workers themselves, on their clothing, or an object brought from the workplace. In the home, contamination occurs via 3 sources: arthropod vectors, such as ticks that are responsible for Lyme disease, transmission on dust particles that are inhaled, direct skin-to-skin contact, or direct contact with contaminated clothing. For nurses, you must be very careful because you wear a lot of things home that may have happened with your patient care, such as fluids from suctioning or a trach, or when a patient may have an incontinent episode and it gets on your clothing. When you get home, it is wise to take your shoes off as soon as you get home and take your clothing off and put it in the laundry. A child has hiccups for 2 hours. Is this a sign of suspected ingestion of poison? And the answer is no. But a few signs of suspected poison ingestion are behavior changes like restlessness and crankiness, diarrhea, dizziness, drowsiness, fatigue, headache, loss of appetite, minor skin or eye irritation, nausea or upset stomach, a passing cough, one that comes and goes, or soreness or stiffness in the joints. Motor vehicle injuries are the second leading cause of accidental death in American adults and children older than 1 year of age. They account for about 37% of all accidental deaths. Failure to use seatbelts and proper child car seats continues to be the major contributing factor. Severe injuries and death also occur from airbag deployment when young children are improperly placed in the front passenger seat. Parents need to be aware of the laws in the state that they are in and about where children should be sitting. If children are in the front seat, it is said that airbags should be turned off due to the injury to the neck and face. If you work on a mother-baby unit, one expectation is that you inspect the car seat before the parents take a newborn home. They must know how to install it properly into the car and that the infant is placed correctly into the harness. Many of the fatal motor vehicle accidents during adolescence involve abuse of alcohol or other substances and texting. Driver distraction from the talking and texting with cell phones is a major contributor to fatal motor vehicle accidents for adolescents and adults. The risk of being injured or killed in a car crash increases for older drivers. Every day, on average, 500 people over the age of 65 are injured in an automobile accident. As you all know, a pathogen is a microorganism capable of causing illness. Community-acquired pathogens are those that are not transmitted by healthcare settings. One of them is foodborne. This is a nonspecific term that describes illness caused by ingesting bacteria and other microorganisms or their toxins in food. Improper food storage and preparation are a major cause of food poisoning. Raw foods are commonly associated with foodborne illness. For example, raw meat, poultry, eggs, shellfish, raw fruits and vegetables, and unpasteurized milk and fruit juice. Poisonous chemicals in the environment, such as mercury, arsenic, zinc, and potassium chlorate, may also contaminate foods. Education is an important intervention for preventing food poisoning. Vector-borne pathogens are those transmitted by one host to another. Organisms that transmit pathogenic bacteria, viruses, and protozoa from one host to another. These include mosquitoes and other insects, rodents, birds, and other animals. Often, deer transmit Lyme disease by ticks. That is why it is important to check for any abnormal spots on the skin when having been in wooded areas. Waterborne pathogens are typically transmitted by unclean water. People who live in substandard housing may not have safe drinking water, hot water for washing, or adequate methods of waste disposal. You may also hear a town state that they have had a water main break. This would be a cause to boil water because of the bacteria that can be released into the water system. People in rural areas often depend on private wells, which may not be adequately maintained and tested for pathogens such as Giardia, Cryptosporidium, and E. coli. Motor vehicle emissions are a major cause of outdoor air pollution in the United States. Other toxic air pollutants are asbestos, toluene, a chemical found in paint, metals such as mercury, chromium, and lead compounds, and other emissions from factories or power plants. Indoor pollutants include radon, carbon monoxide, allergens from dust mites, cockroaches, mold, rodents, and pets. Allergens are an important health issue because some people spend most of their time indoors. Passive exposure to tobacco smoke is associated with respiratory disease and cancer, and environmental air pollution is linked to cardiovascular disease and respiratory viral infections. Water contamination often occurs in lakes, rivers, and streams, ultimately affects both recreation and food production of these waters. Pollution occurs when inadequately treated or inappropriate quantities of human, industrial, or agricultural wastes are released into the water systems. If the pollution is severe enough, the water may become unsafe for human consumption or contact. Noise pollutants include substantial exposure to noise that has been associated with a range of adverse health effects, including hearing loss, stress, elevated blood pressure, and loss of sleep. Noise is pervasive in our society, for example, from road traffic, jet planes, garbage trucks, construction equipment, lawnmowers, and loud music. People who live or work near major roads, bus depots, airports, and trucking routes are at greater risk as those who work in certain environments like railroads. Soil can become contaminated by improper waste disposal and excessive use of pesticides. Agricultural, industrial, and manufacturing processes create solid and toxic waste, and animal, radioactive, and medical waste pose special problems. Weather conditions play a major role in outdoor recreation programming. It is important for professionals, participants, and outdoor recreation providers to understand severe weather conditions, specifically thunderstorms and lightning, and the dangers associated with them. One of the first pieces that nurses assess when caring for a new client is their risk for falling, especially when a patient is markedly unsteady or has an illness that affects their gait. The nurse should complete a comprehensive fall evaluation. These are typically evaluated on admission, upon assessment daily, and every 8 hours. Falls are by far the most common incident reported in hospitals and long-term care facilities. Risk factors include poor vision, cognitive impairment, difficulty with walking or balance, orthostatic hypotension, weakness or dizziness, drowsiness from medications. In many cases involve falling from a bed and falls that occur frequently on nights, weekends, and holidays. Most agencies have established procedures and safety features to prevent falls. Equipment-related accidents usually occur when equipment malfunctions or is used improperly. For example, maybe a bed alarm was not working or they did not turn it on. Or when suction devices and infusion pumps are not working properly, the patient may get tangled up in the cords or hurt themselves trying to stop an annoying beeping. Oxygen cylinders are also transported incorrectly, or wheelchairs and beds are not locked during transfer activities. Fire in a healthcare agency is more often related to anesthesia or improperly grounded or malfunctioning electrical equipment. Most healthcare agencies have policies for preventing electrical hazards. Nevertheless, patients and visitors do break the rules, so smoking cannot be discounted as a hazard. A restraint is a device or method used for the purpose of restricting a patient's freedom of movement or access to his or her body. The most obvious form of restraint is the use of physical force by another person. A restraint may also be a mechanical device, material, or equipment, such as a cloth vest or side rails. It can also be considered a chemical restraint given to control disruptive behavior, for example, sedatives and psychotropic agents. Remember, use restraints as little as possible. Research shows that they do not do much in the way of preventing injury. In fact, they may cause more harm than good. The nurse should utilize other forms of fall prevention first. So, for example, if a patient is constantly attempting to get out of bed despite being reminded by staff, perhaps having a family member the patient recognizes can stay at bedside. This will make the patient less agitated and may listen to family's orders. Mercury is a heavy, odorless, silver-white liquid metal. Mercury is toxic in both acute and chronic exposure. It can be inhaled, ingested, or absorbed through the skin. It accumulates in muscle tissue and can cause renal and neurological disorders, especially in the fetus and neonates. Products containing mercury, including thermometers, thermostats, batteries, fluorescent light bulbs, blood pressure devices, and electrical equipment and switches, have been contained and taken away from healthcare facilities. In 1998, the American Hospital Association and the Environmental Protection Agency launched a program to eliminate all use of mercury-containing products. Unfortunately, some facilities still use them despite their known harmful risks. When implementing the use of restraints on a hospitalized client, the nurse should The answer is C. Ensure that the primary care provider renews the order for restraints every 24 hours. The statement meets the most current guidelines for the provider's orders related to the use of restraints. If the doctor does not order a new restraint order, then the restraints must be removed. The American Nurses Association reports that 52% of nurses report chronic back pain, likely because many nursing tasks require bending and twisting of the torso, activities that can cause injury when the nurse does not use proper body mechanics. Among the most stressful activities are transferring patients, this could be from the toilet to the chair or vice versa, assisting patients out of lying or sitting position, lifting a patient in bed, repositioning patients in beds or chairs, and changing bed linens. The ANA states that manual patient handling should be used only in exceptional situations when it cannot be avoided. For these situations, you can reduce your risk to some degree by using appropriate body mechanics. Healthcare workers, mostly nurses and housekeeping staff, suffer up to 1 million injuries per year from needles and other sharps, putting them at risk for infectious diseases such as hepatitis B and AIDS. Since 1992, the Occupational Safety and Health Administration, or OSHA, has required employers to provide engineering controls such as safer medical devices and needleless systems. When working with needles or other sharps, it is important that the nurse locate the sharps container and keep all needles away from others when transferring the sharps device. Radiation is a process of emitting radiant energy in the form of waves or particles. Ionizing radiation is used in computerized tomography or CT scans, and in diagnostic radiology, linear accelerators in radiotherapy, and positron emission tomography or PET scans in nuclear medicine. Patients are deliberately exposed to radiation during diagnostic tests and certain medical treatments. Healthcare workers who care for patients are unavoidably exposed to small doses of radiation. Nurses and radiology technicians should be aware of the dangers of exposure and limit the amount of time in the radiology area and wear lead aprons or any other protective equipment necessary when in these areas. Hospital security may not be sufficient to protect you from injury or if violence breaks out among patients, visitors, or staff. This is especially true in the emergency department, which has 24-hour accessibility and many times can be crowded and chaotic. Under the stress of an acute illness, patients and family members alike may be anxious and angry and act out in ways that are unpredictable and atypical for them.